Good afternoon, everyone. My name is Rudy Page and welcome to another of our community wellness dialogues. And for the next few minutes, we'll be focusing on HTLV1, raising awareness, improving community understanding, and really letting the community know what the call to action is. And I'm really pleased that we have Carol, researcher for HTLV1. Hi, Carol, how are you doing?
Hi, I'm fine. Thank you for having me here. It's a pleasure to be here with you today.
Thank you very much. So Carol, just before we start, tell us a bit about your role within the area of HTLV1.
So I am an HTLV researcher. I work at Imperial College, London, and my research have been focusing on the prevention of mother-to-child transmission. And I am an advisor for the Brazilian Ministry of Health. And I also have a YouTube channel to increase awareness about HTLV and to do a lot of community engagement in Brazil as well.
Okay, so from your perspective, what is HTLV when people ask you that question? What do you say?
So we usually answer this question by using the formal definition. HTLV is a heterovirus that will affect a lot of people in the world and is extremely neglected. And HTLV has an impact on people's life that is much more broader than the health impact. So it's very important to have spaces like this to talk about HTLV.
Thank you for that. And so what are the main public health policies being implemented to prevent HTLV1 in Brazil?
So the implementation of public policies to HTLV in Brazil date back to the 90s with the recommendation of screening of blood donors. But recently, we have observed a very good progress. And the most recent and most important public policy that has been implemented was the antenatal screening for preventing HTLV mother-to-child transmission, and also the recommendation to provide formula for those women that are infected by HTLV.
Thank you for that. And what are the main barriers for the implementation of these public health policies?
So we have a lot of barriers to implement policies like anywhere in the world, but I think the main barrier is still the lack of awareness about HTLV. So I think that if people doesn't know what is HTLV, if they don't know the effects of HTLV, it's quite difficult to implement health policies. So I think this is the main barrier. But of course, we have some other barriers, because in Brazil, there is instability in the technical group that works with HTLV in the Brazilian Ministry of Health. So this is quite a problem when we are thinking about implementing policies that are long-term, and if the group keeps changing all the time. We also have a very huge diversity in the country in many different aspects. So it's quite difficult to implement policies in a national policy in Brazil. And we have a lot of different demands on healthcare system, and this was accentuated by COVID-19. So I think these are the main barriers.
So which particular population groups are the most affected by HTLV1 across Brazil?
So we have HTLV spread all over the country. So basically anyone can be infected by HTLV, but we can observe higher prevalence in some regions in Brazil, mainly the Northeast region. And we have those most affected, usually they are particularly women, Black community with low income and low education level. And it's a very interesting finding that we saw in a recent study that women who suffered domestic violence, they were 9 times more infected by HTLV compared to those who didn't suffer violence. So it's a virus that is affecting those in vulnerability.
Right. So can you share with us a case study, your case study from Brazil?
So I think that to share this study, I think the most interesting thing that happened recently was the road that led to the implementation of this recommendation for the antenatal screening. And this, of course, started many, many years ago with all these efforts of different researchers, different community actors. So I think this is the result of a collaborative work, and this is quite important because patients, they started organizing their communities, they started raising their voices, started locally in some states where we have a strong patient advocacy groups, and these was supported by researchers, and they started to communicate better with policymakers. So I think that the achievements of the recommendation is actually the response of a work that was made by the community, raising awareness, showing their perspective, their experience, showing that their needs to implement antenatal screening and why they want antenatal screening. And then the researchers need to do their job, showing the evidences to support why we should implement antenatal screening, why it is so important. Is this effective? Yes, we have the evidence. And sometimes it's just looking for the evidence that is already there, but the policymakers and the healthcare professionals, they are not looking at it. So I think the community and the researchers, they have a very important role showing the importance of a policy. And then the policymakers, they need to be open to listen. But I think that what you have written in your slides, HTLV awareness, understanding, and action, this is exactly what we need to do. Because if we increase awareness, we have to show what is the impact of HTLV? How can we prevent new infections? And then the action will be a result of this. Because it's quite difficult to show everything and then someone say, oh no, this is not important. So we need to create this, increase this awareness. I think this is the most important part, and it's sometimes under-recognized. So people don't value much activities to increase awareness, but this is the core to implement a policy.
Even though we all subscribe to prevention is better than cure.
Yeah, it is in HTLV is quite important because at the moment we don't have a curative treatment. And this is unbelievable. Sometimes this is what we hear when we say we have to test for HTLV in sexual health clinics. And then the policymakers, they can say, oh, but we don't have a treatment. But this is exactly the reason that we should be testing to prevent new infections at this point.
Absolutely. I'm interested to understand a bit more in terms of how the trust was built up between the researchers and the community. Because that to get that evidence can be quite challenging.
Yeah, it is very challenging, but I think that HTLV research community is quite differentiated because it's so neglected, the virus, that the researchers, they need to be passionate about HTLV. And so this communication is usually there because a lot of them are taking care of the patients, so they have this connection already. So it's quite important for the researchers to be able to listen to the patients and also support the patients so they can feel that they can share their experiences, because it's quite important, because some patients will feel that they don't want to say that they have HTLV, or they think that they suffer stigma. And when they show their face, when they show that they are not a number of a person who is infected, but they have their lives, they just need to show who they are, so they will get stronger. I think this is the issue. And the researchers may support them, give them also the tools for them to get organized, to raise their voices during the conferences. I think this is quite important.
Right. So another aspect to the case study then. So having got all the information as researchers, then what was then the academic support, you know, and the healthcare professionals themselves, in order then to influence some of the policy decision makers, the commission?
Yeah, this is a very good question, because even if we have the recommendation like we have now, if the healthcare professional, if they don't know about HTLV, the policy will not be implemented in their daily routine. So this is another important issue. And in Brazil, what the Brazilian Ministry of Health is doing, because this was something that the patients, they told us one of the main difficulties that they face is the lack of knowledge among healthcare professionals. So the Brazilian Ministry of Health, they are doing a lot of, they are including HTLV into all the sexually transmitted infections courses. So for healthcare professionals. So they are including HTLV, everything that is sexually transmitted infections, now HTLV is being included. So I think this is a good strategy to start with, because some people, some healthcare professionals, they will not be interested in looking for HTLV if you just say HTLV. But if it is inside another infection together with HIV, you have HTLV, then they will start thinking, oh, what's this? I never heard about this. And then they will start looking for it. So I think this is a very good point. And also some associations, like, for example, gynecologists or sexual health care practitioners. So these organizations, we can use their organization to spread information about HIV. This is quite important as well.
Of course. So what are the key priorities for community groups and healthcare professionals who aim to achieve similar outcomes?
So I would say that the first priority would be to get together as a community, patients, overall community, researchers, healthcare professionals, and policymakers. They're quite important to have this collaboration, because you need to show them the evidences that what they are looking for. And I think that this can be achieved if the patients organize themselves as a community, but also as an individual. So sometimes patients, they keep complaining, oh, I wish we had HTLV antenatal screening. I wish I had this. But if they try to propose new ideas, or they can do their own parts, sharing information about HTLV. So I think each individual can do their own part. So I would say that the priority will be working together to increase awareness about HTLV. I think this is the most important starting point, is to showing what is HTLV, the effects of the infection, how the people feels when they are infected by HTLV. So this is the most important thing, because then it's very difficult to someone to say, oh no, this is not important. So they will have to do something about HTLV. If you show antenatal screening, you can prevent new transmissions. So they cannot say, oh no, we will not implementing this because there is no treatment. We have to show the evidences.
Right, okay. And then finally, around the case study, what I'm very interested in, what to you was the highest barrier that you had to get over, really, in order to achieve the overall outcomes that you did achieve?
I think that sometimes the lack of information is quite difficult, because when we are saying to a policymaker, you have to implement this policy, and then they will say, oh, but I don't know how many people are infected, but we don't have funding for research because it is neglected. So it's like a vicious circle. So we need to break this. So we need to show we have evidence. It might be not ideal, but we know that this community is affected. We know this is a reality. And then we have to show, gather the information that we have,
data collection.
And this is only possible if we have a strong voice. And if we are looking for the data that they want, because sometimes we are looking and this is not exactly what they want to know. So we have to show them what they want to see. So if they say there is no HTLV here, so we have to show evidences, numbers, we have to show people that are infected sharing their history. This is quite impactful. I think this was really, really important when those infected with HTLV, they got together and they shared their experiences.
Those patient stories are powerful.
Very powerful. And they don't realize the power that they have. So they need to use this power, because it will be quite helpful for the community as a whole.
Yeah, and as we say, if you want representation, you've got to get involved.
Yeah, definitely. Because a lot of people, they say, oh, because there is no one, I don't know anyone that is infected, but they don't get involved and just reach out, because nowadays it's so easy to reach out to anyone. You can find the person in Facebook, on Instagram, and then just send a message. I'm sure that someone will reply because even when we face some barriers, we cannot give up. We need to keep trying. So I'm sure that someone will answer, and then you can share information, and I'm sure that they will find a way to help to implement policies more effectively.
So thank you very much for that, Carol, and keep up the very good work.
No, I will try. And you too, thank you very much for having this space. I think this is very, very important, and I hope you can keep helping HTLV increasing awareness. Thank you very much.
Certainly will. See you again soon. Goodbye.
See you. Bye.